Cystic fibrosis imaging, solutions for traveling to specialized centers. Imagine needing regular lung scans but living far from the specialized clinics that can do the best imaging for cystic fibrosis. Traveling for these tests can be tough, but there are smart ways to make it easier. The main goal is to get accurate images of the lungs while reducing the burden of travel and keeping radiation exposure as low as possible. In cystic fibrosis, chest X-rays are often the first step when symptoms worsen. They are quick and helpful for spotting infections or lung changes. However, for detailed monitoring, doctors prefer computed tomography scans, especially low-dose CORT scans. These scans give a clear picture of bronchiectasis and small airway problems, which are common in cystic fibrosis. Low-dose CORT scans use less radiation than traditional scans and can be safely done every 2 years for routine checkups. This way, patients get the detailed images they need without unnecessary radiation risk. Since specialized centers have the best equipment and expertise, traveling can be a challenge. To address this, many clinics now use low-dose CORT protocols at more local hospitals. This means patients can often have their scans done closer to home, saving travel time without losing diagnostic quality. Scheduling imaging during regular visits to local clinics can also cut down on extra trips. Technology plays a big role too. Telemedicine allows doctors to review scans remotely, so patients don't need to travel for every consultation. Local hospitals can send images to specialists at larger centers for expert interpretation. This partnership helps ensure patients get the best care without always needing to visit the specialized center in person. Looking ahead, magnetic resonance imaging might become a useful alternative. MRI scans do not use radiation and could someday replace CORT for lung imaging in cystic fibrosis. But for now, low-dose CORT remains the standard for detailed lung assessment. For liver issues related to cystic fibrosis, imaging is also important but less frequent. These tests can often be coordinated with lung scans or other appointments to reduce travel. Overall, managing cystic fibrosis imaging involves balancing the need for detailed, timely information with the goal of minimizing travel and radiation. Personalized schedules, local imaging options, and remote consultations are practical solutions. Always remember, the best approach depends on each patient's unique situation, so working closely with cystic fibrosis specialists is essential to choose the right timing and type of imaging. Following current guidelines and expert advice helps ensure safe and effective monitoring for every individual.